Good evening, everyone. Welcome to the SIUK India YouTube live session with UCL. I am Surti and I'd like to extend a warm welcome to everyone who has joined us today for the special UCL webinar on MBA in Health and Healthcare. Our speaker for today is Dr. Julie Davies, Director, UCL MBA Health Program at the UCL Global Business School for Health. We also have with us her colleague, Adam Widler. Dr. Julie has a significant senior leadership experience in business and management education. Julie is a reader at Manchester Metropolitan University in the Department of People and Performance and Center for Decent Work and Productivity. She has delivered the Open University's MBA for over 25 years, and she is a fellow of the Chartered Institute of Personnel and Development at the Higher Education Academy. Julie is also a trustee of Kirkwood Hospice. Her current research includes projects on early pregnancy endings at work and transitions of advanced clinical practitioners. She's also co-authoring a book on the leading business schools for the 50th anniversary of the European Foundation for Management Development. Julie is a UKRI, UK Research and Innovation peer reviewer and associate editor for Human Resource Development Review, and has published in journals such as the Academy of Management, Learning and Education, Employee Relations, Gender, Work and Organization, Journal of Business Research, Journal of Small Business Management, Management Learning, Stress and Health. She co-chairs the Research Development Committee for the University Forum for Human Resource Developments, and she is a member of EFMD's Doctoral Programs Committee in addition to the Greater Manchester Good Employment Charter Technical Panel. Most recently, Julie has led research projects funded by Erasmus and her Health Education England, and she was content advisor for the UN Women Second Chance Education Program for Chile and Jordan. She worked in human resources in the National Health Service in central London with experience in primary and acute care. During this time, Julie was seconded to the Change Development team for the opening of Chelsea and Westminster Hospital. She has facilitated executive educational workshops in Australia, Brazil, Canada, China, Eritrea, Ethiopia, Finland, Japan, Kuwait, New Zealand, Norway, Sweden, and Russia in public, private, and non-profit sectors, and regularly presents at the Academy of Management annual meeting. Previously, Julie was Deputy CEO of the Chartered Association of Business Schools, where she launched and directed the International Dean's Program. She was a visiting scholar at the University of Melbourne and has worked at Bayes Business School, Birkbeck, Huddersfield Business School, SOS, and in UCL's Department of Chemistry. Julie is highly committed to continuing professional development and lifelong learning. She earned a PhD in the Strategic Management at Warwick University, completed an MBA and MA in Education, and she has a law degree in a first degree in Modern Languages. Julie has also participated in the National Teachers Program in Chicago, AACSB Bridge Program in Washington, D.C., and Harvard Law School's program on negotiation in Boston. She's a qualified executive coach and a psychometric assessor. Thank you so much, Julie, for joining us and taking out the time for our students for doing this session. We will now begin with the session. For any queries that students may have, please type them in the chat box and they will be answered post-presentations. Over to you, Julie.
Okay, thank you very much, Surti, for that very generous introduction. So I'm delighted to join you today. We have some excellent students already who have been offered places on the MBA Health program at University College London. So we're very interested in continuing to talk with you, and we're busy recruiting for our 30th of June deadline. So today I'm going to present some slides and then we'll open up for questions with Surti fielding those questions and moderating. So today I'm going to talk about the world's first global business school for health, dedicated to health, and our MBA Health, which is dedicated to health and healthcare and social care. So there is a saying that health is wealth. You know, you need your health to be wealthy. Just being wealthy is not enough. So what I'm going to talk about today is who we are, the case for why an MBA in health and not a general MBA, why the Global Business School for Health in particular, give you some indication of the kinds of student profiles and the careers we imagine those students to go into following their graduation, the structure of the MBA Health, particularly the projects. I'll also then talk about admissions process, the kind of interview questions we ask you when we interview successful applicants online, and the scholarships available. And then finally, I'll talk about life at University College London, London itself, and how you can keep in touch with us at various open days, webinars, and getting in contact with me directly if you want to follow up. So firstly, who are we? So a year ago, the Global Business School for Health was founded in the UCL, which is a leading research-intensive university that specializes in health care. So it's totally dedicated to producing the next generation of healthcare management leaders. So what we're doing, clearly the pandemic has had massive disruptions in society and in healthcare in particular. So we're looking at how we can reimagine global healthcare management and systems, how we can unpick the kind of challenges that clinicians and non-clinicians in the sector face from a particular perspective of management and leadership and business. So we're here to question the status quo, look at what works and what doesn't, thoroughly underpinned by research and practitioner inputs. So clearly, ensuring healthy lives and promoting well-being for all at all ages is a 2030 UN Sustainable Development Goal. So we take that goal very seriously and integrate other goals such as climate change and focusing on equalities. And a WHO report a few years ago, 2019, found that most healthcare is delivered by women, but led by men, which was the title of the report. So typically around maybe 20%, if you're lucky, healthcare leaders are women, and the majority of people actually delivering the service, and obviously clearly using the service, is much higher than that. So we need to rebalance those inequalities. So bringing together SDG 3 and a business-minded view of the world is great for people's careers to integrate the two. So Dr. Kim Clark, who was the former dean of Harvard Business School, famously said that business and medicine and business have long been intertwined, but today with the extraordinary promise of emerging medical technology, sweeping change in the delivery of healthcare, and the push to control the costs of medications, the need for leaders firmly grounded in both fields has never been greater. So my research particularly looks at these hybrid professionals who may be medical directors, or they may be managers who've come from social science, who are healthcare professionals, how they interweave the language, speaking the language of clinicians, as well as speaking the language of politicians and business people. And I have been teaching, as my introduction said, the general MBA for a very long time. So there are lots of thousands and thousands of general MBAs in the world, and some of them have a little bit of health attached to them. But what we have is health all the way through. Before you arrive, you'll be doing exercises linked to global healthcare systems. Most of our case studies will be on the healthcare sector. Our executives in residence have been CEOs or are currently CEOs or very senior people or entrepreneurs in the healthcare sector. So we live and breathe at GBSH Health and Management and Leadership. So it's in our DNA. So as you know, the healthcare sector is very complex. There's lots of moving parts. How do you integrate health in acute hospitals with community primary care and social care? So we look at that, and we look at things from a cross-disciplinary point of view. So at UCL East, there are many different disciplines, and as well as UCL more generally. So we may have robotics going on in the building, we have people in psychology, and we look at the complex sector of healthcare, private, public, non-profit, charity points of view, also looking at cross-disciplinary approaches. So for example, we look at maybe what GPs are doing as kind of businesses in themselves. And we link this all the way through from day one with your long-term career goals. So I guess another question, I was just talking to someone, one of UCL's alumni this morning in Germany, who's at Merck, who's on our board, Jit Saini. And he said to me, well, why should we bother to have an MBA at all, Julie? I just learnt it on the job. On the other hand, I'm also talking to lots of dentists and medics who do have MBAs, and they found it very valuable. So we came to the conclusion, talking with Jit at Merck this morning, that the MBA Health, of course, you can learn on the job, but the MBA Health actually accelerates your career opportunities. So I've often talked to people who are very senior or who have just got their first leadership or management job, who are maybe in their 30s, who said, you know, that MBA has just broadened my outlook. It's made me into a kind of T-shaped professional. So I was very specialized, perhaps in marketing or the legal side of health or in clinical, but the breadth of the MBA has made me appreciate the finance director's point of view. It's made me understand operations, and it really has accelerated my career because I can speak the language of operations, of the surgeons. I can understand my own self-development, and it's got me to the next step on my career much faster than if I had just tried to learn on the job. So hopefully it will open up new career opportunities, allow you to pivot. Maybe you're not in the healthcare sector, but you'd like to get into the healthcare sector. Maybe you're a very specialized clinician and you want a broader view. You want to change the system you're in. Self-confidence is a huge outcome of the MBA, and humility. Developing your self-awareness. You'll do psychometric assessments. We have a residential school at the very beginning, so we go away to the countryside for a weekend, and that it focuses on you, your learning styles, your preferences, your areas for development. And every class we have in person, you will have time to reflect and write in your learning log how you are developing as a person, as a student, in the group, on your projects, in your interactions with executives and academics on the program, and more broadly. And I guess you may be very, very good at what you currently do in terms of your personal contribution, but clearly getting things done through others, which is what Peter Drucker famously said managers and leaders have to do, is very different. People are not robots, they're not machines, they have emotions, they have lives. And motivating them to do the work that you don't have to do because you can delegate to your teams is a dynamic process, and emotionally and psychologically, challenging for leaders. So how do you build that kind of capability in emotional intelligence, social capital, your networks, political skills, which will get you further and get people to listen to you and your ideas. Also, you may be looking to form your own business, develop maybe some executive roles in consulting or on boards. So how do you develop a portfolio career? And over our lifetimes, I think typically now we have different transitions, different careers. So how do you develop that? If you have a 100-year life, how are you going to change your career and adapt to different opportunities? So clearly we'll get to the MBA content, which is very valuable. I think the theoretical frameworks to see the world in different ways. And it really fast forwards you into challenging experiences, but in a very supportive environment to help you be a more thoughtful and kind of evidence-based decision maker. So we offer a kind of boot camp experience. You have an intensive year. We teach mainly in the afternoons, and we have breaks between the teaching blocks. But while we're on the blocks, it's quite intensive. And we really expose you to the latest thinking on healthcare management and lessons from the past to look forward to the future. So as I said, we teach you a lot of analytical, technical skills, finance, economics, data management, AI, big data. But we also teach you and develop your competencies in soft skills. So how do you develop mindfulness? How do you deal with difficult people, difficult situations, challenging political scenarios? And this will develop your credibility in multiple domains. You can speak the language of different kinds of stakeholders and different kinds of management functions. So you can speak economics, you can speak corporate finance, you can speak entrepreneurship. So typically at the MBA Health, we're looking for people at early career. This is or mid-career if they want to reboot their trajectories. And this is a face-to-face in-person experience in London. And what we're really offering is one of the top universities on the planet. So UCL is 8th in the world for research. It's 1st in the UK. And unlike other top universities in London, like London Business School or LSE or Imperial, it is a fully comprehensive university. So you will meet historians, you will meet linguists, you'll meet social scientists, but health and medical and life sciences is the kind of lifeblood of UCL. So you have the strengths of those STEM disciplines. It has a medical school, a dental school, but you also have a kind of rounded experience. So that really is why the Global Business School for Health, which is a kind of startup business school in a old, established, traditional, research-intensive, very big university. So we had in our offices yesterday the chief executive of 5 hospitals of University College London Health NHS Trust. So David Probert is the CEO of a brand new hospital next door to us, 5 minutes away, and he will be working closely with us. You'll be in his office, you'll be visiting his ED department. So you really have people who understand the cutting edge of what is going on globally in healthcare systems. My deputy, John, is on this call. She is joining us from India and is a fellow at Harvard. So we have people who are not just from the global north or the west, but people who understand other parts of the world quite intimately. And we have plenty of resources to help you engage live with our networks, for example, at the World Health Organization. We had a webinar the other week with Jim Campbell, who's Director of Workforce there. So it may be very difficult as an individual student to get in touch with any of these key people who are running global healthcare systems globally, but with the huge brand name of UCL and with our contacts, we can open doors to give you people's personal emails and telephone numbers, very direct engagement with very senior people in different parts of the world. So we have around 30 executives in residence who will be working with you closely. We have a recruitment agency and one-to-one coaching to really help you reflect on your career plans and where you will go beyond graduation. And we have UCL alumni also who can help you. And we firmly believe that once you've joined GBSH, you kind of never leave. we will be inviting you back to speak. We will be celebrating your successes. There are discounts on our executive education programs as well that you can benefit from. So we really see this as a genuine lifetime opportunity that will be transformational for your careers if you join us in September 2022. But well beyond that, we see this as a kind of a lifetime network. So this next slide, I'd just like to touch on what kind of student is joining us. As I said, it tends to be with the MBA Health early or mid-career individuals. You need a good academic background or clinical background with some work experience that maybe you've gained full-time or you've gained during your studies or by volunteering. We want people who are ambitious and determined, who will make an impact on the world during their studies and when they graduate. And clearly we'd like you to stay in the sector somehow, but that is a very big sector. So it may be big pharma, you may want to go into biotech, an entrepreneurial role, management consulting for a huge consulting firm. So it's entirely up to you where you want to go, and you'll be able to try different things out through our networks. And obviously your peers are a great source of resource as well and contacts. So we have Mark Bricknell from KPMG, who's a partner in the healthcare, global healthcare there. So you'll be actually taught by him. We have contacts in McKinsey in Saudi and other parts of the world with some of these big consulting firms. Careers you can also look at clearly in NGOs like the World Health Organization, Bupa has lots of clinician managers, and the NHS clearly is one of the largest organizations in the world, so there are opportunities there. We also have a master's program linked to the pharmaceutical industry. So there may be opportunities that you'd like to pursue. We also work very closely with entrepreneurs. So one of our case studies will be Proximi, which one of UCL's alumna, she is a surgeon, and they've just had a brand new case study with Harvard Business School, and we will be working on that case study with people who are in that organization, and the CEO, Nadine, who was a UCL graduate and is a surgeon working in a hospital in London. Those of you who want to work in the legal side or in government, we certainly have students who want to be ministers of health one day. We also have contacts and modules on regulation and legislation and policy development. Some of you might want to do some teaching, some research in the healthcare realm, so we encourage that as well. Others might want to work more on data analytics and digital technology, which is very important in healthcare. And some of you may want to continue on your clinical pathway, perhaps one day be in the C-suite as a medical director or a CEO of a hospital or a healthcare organization. Okay, so the next section is looking at the program itself. So the location will be in UCL East. So there is an amazing brand new campus being built on the site of the 2012 Olympic Park. So we have state-of-the-art kind of Googleplex facilities in East London, which is very, very exciting. So it's a 12-month program, full-time. We do have one student, Chinese PhD student who's just graduated in the UK, who's going for the part-time program. And we start on the 26th of September. And the tuition fee is 45,000, but we have scholarships, quite generous scholarships, which can reduce that. UCL scholarships, GBSH scholarships, and there are other wider scholarships. So basically the program, if you look at the bullets on the left, it's designed to ultimately improve patient care and lives. So it's to strengthen health and healthcare management in a range of different kinds of organizations throughout the world, and to generate the next cohort of exceptional leaders in the sector. So an MBA is about bridging the gap between theory and practice. So all the time you will be interweaving theoretical frameworks with evidence from case studies and real life organizations. So I always encourage my students to write all over the models. If you have a model and you write on it with evidence, that's the kind of discussion we want then from that annotated model in essays, in presentations, and so on. Always linking theory, theoretical frameworks of looking at the world, critiquing the models, and using them as tools to sort out real life challenges. And yesterday, David Probert at UCLH said, you know, lots of talk is, you hear, is about big transformational change. But sometimes those small changes, small wins can be really transformational as well. So we give you all the attributes of a traditional MBA, as I said, but we make sure that you're able to go out into the world as mediators and communicators and negotiators within the healthcare domain, which is growing all the time. So gross domestic product expenditure on healthcare globally, it already exceeds 10%. In the USA, it's far more than that. Clearly in other countries, it's less, but growing. So we were looking with Jim Campbell at the World Health Organization the other week at decent work. And certainly one of the definitions of decent work is full employment. And certainly because of the shortages of healthcare workers, you know, certainly in terms of having work and working opportunities, there are lots and lots of them, but clearly we need to make sure that leaders and managers ensure that it's decent work as well. So we're looking to improve patient outcomes through innovation, through championing and importantly, universal access to healthcare. And we certainly think that our graduates will be highly desirable once they come through our program. So a little bit in the next slide about how we deliver the program. Before you start, there will be online primer courses to kind of fill in some gaps. You may never have done corporate finance. Maybe you've never thought about different global healthcare systems. So we give you some kind of general courses and some quizzes that you can kind of just give you some content to update you, as well as exercises, psychometric exercises and others linked to your personal development, dealing with organizational behavior and team building. And then, as I said, we'll be going to the countryside in a hotel for 3 days after your UCL general induction and GBSH induction. So we'll have specific insights into group team building and getting to grips with your personality results and so on, which will help shape your understanding of yourself and how that links to your career ambitions and the content. And then the actual program, you have four-week taught programs specifically on functional areas. So you kick off with strategy. We have 2 people delivering that, one who managed and founded his own consultancy business for many years and a practicing doctor who also has his own business outside the UK. I'll be delivering the people module for a week. Marjana and a colleague from GE will be delivering the marketing module for a week. And then you'll have a 1-week wrap up at the end of that that brings it all together before you go away and work on the assessment, which is an essay and a group presentation. Then you'll have a break in the first term, and then you'll look at funding, corporate finance and regulation. Similar 1 week for each of those, followed by a wrap-up week, guest speakers, quizzes, visits, case studies, lots of different activities throughout those. And then you have a vacation. We come back in January and you actually go off on a 2-week field trip to either Lagos, Riyadh or India. And then we do 2 more blocks. So there's a block on data-driven management that looks also at economics. So you have 4 weeks of that. Then you have a break to do the assessment. And then with Pretty John, you'll be looking at contemporary topics in health and healthcare. So again, we have 3 topics plus a wrap up and then an assessment. And across those, the other 2 aspects are the Global Health Challenge project. So this is in a low or middle income country. The 8th or the 9th of January, you will be in Saudi Arabia, Nigeria, or India, if you wish, for 2 weeks of field work. So clearly before that, you also need to do lots of preparation. So this is a group project. You present a single report as a group and a presentation as a brief to your sponsor. So we will be linking you in each country with projects that you can do as a group. And clearly when you're in the country, it's important that you do your interviews, you collect data, you meet the people relevant to your project. So with you will be a supervisor from GBSH, and it's really to develop your business skills. So you need to kind of help the organization that you're dealing with solve their problem or work through their problem. And clearly also you need to write a report that works academically, that includes relevant academic papers and thought leadership as part of that. So I find those kind of fieldwork experience life-changing. Harvard is very famous for doing case studies. And then in 2008, with the global financial crisis, it realized selling cases, how wonderful Enron was, or how brilliant the Icelandic banking industry was not a good idea necessarily. Some of these cases are not terribly helpful. So they updated their cases, but they also had a massive launch on field work. So even at Harvard now, they realize this kind of global health challenge is really, really enriching, life-changing. People never forget these kind of projects. And then to help your career, clearly you're not going to go as a group for a job, well, you may do, but you're going to go individually for your next job or go back to your country to perhaps do your job differently. So we also have this individual health consultant project. So we will have some examples of projects. So for example, we have a project from Kiajin. They want a student or a couple of students to look at TB infection in Oman. They've been working very closely with the government for 10 years, and they really like some students to be part of that. So you'd get a Kiajin email, you'd be part of the Kiajin team working on their project in Oman. Merck this morning is also going to give us some projects. They have projects in India, Africa, Germany particularly, but obviously globally is a global healthcare American international. But you can also bring your own project. So you could say to us, I really want to go and work for KPMG. I really want to go and work for WHO. And we can design your project with our contacts to help you get, or at least give you a much better chance of applying for that job in WHO or Merck or KPMG, wherever you want to go. So this is really working independently, or you may work with several others, but you submit your assignment to be marked as an individual. So basically, it's to work on a specific problem in an organization for a client, as if you were a health consultant yourself. So you get a careers coach to help you develop your consulting skills with your partner organization. And it's a proper consulting project. So you have to have in-depth knowledge of that organization, as well as the issue at hand, and relate it, compare it with other organizations, what they're doing. So this really does hone your research skills and your project skills, and how to deal with tricky clients and their expectations. And maybe you come up with a solution that they don't like. So how do you deal with those kind of scenarios? So on Wednesdays, all the way through the year, we will be developing your skills for the Global Healthcare Challenge and the healthcare project. So those are kind of things you'll be doing throughout the year, but the actual submissions are at the end of the year. Okay, so as I said, we want people who are ambitious. Clearly, not happy perhaps with the status quo. MBAs are often spaces in people's lives for them to think differently. I did my MBA because I thought, well, my day job's a bit boring. I'm not sure where I'm going next. And it's kind of a transition learning space, headspace for you. So you may be a manager already in healthcare. You may not be in healthcare at all. You may have gone through a medical curriculum that equips you brilliantly for treating patients, but not for changing the system or managing things within that system. So we have a very mixed group of people. As I said, we have architects, we have lawyers, we have marketeers, we have dentists, we have pharmaceutical scientists, we have physicians, we have quite a range of people, psychiatrists already. We've offered places to. So they're really, really exciting. Geographically, very mixed. Nepal, Kuwait, Saudi, the UK, India, a whole range of countries, which makes it really exciting for us as the team, and also I think for peers in the group. So you should have ambitions to work in healthcare. You may have healthcare experience or leadership, but you are quite determined, not just for yourself, but to make social impact linked to those sustainable development goals. And you really do want to, embrace responsibility. You do want to be responsible leaders to make a difference. So in terms of practicalities, we're looking on your applications for evidence that you have the equivalent, or you have a UK degree, but the equivalent of an upper second, a 2-1 degree, or an overseas qualification that's equal to that. If you don't have the relevant classification, you can tell us about your relevant work experience. So we're looking for a kind of package. If you need to meet the English language requirements at UCLH, so these are things we can't give any waivers for. They're UCL policy, so UCL policy. Even if you have an English, you studied in England, you still, if you don't meet the requirements, you have to give evidence. So basically we need IELTS generally at level 6.5 or above, and in each particular area, no points lower than 6.0 in the subtests. There is a language opportunity. You can study pre-MBA language courses at UCL, and you won't have to do the IELTS if you pass the tests on the language course at UCL. Ideally, we like 2 to 3 years minimum experience, so we're not looking for 21-year-olds who've just graduated. We want people who've had some kind of experience being managed or managing others, which may be voluntary, informal, or formal. We have a requirement for a well-balanced GMAT score or a valid GRE score, but we do give waivers, so it is possible to request a waiver if you have a particular reason. But we're looking for a full package. So we look for a balanced view of these, and we interview all candidates. So Professor Nora Colton and so Nora Colton is head of the Global Business School for Health. We interview people for around 20 minutes on MS Teams with the kind of questions I gave earlier to get a feel for whether you would be the right fit and we would be the right fit for you going forward. And finally, we require a personal statement and 2 references. So ideally 1 academic reference from a professional email, ideally, if possible, and 1 personal reference. So these are the links to the GMAT exams. Most places now you can do them online. You can practice the tests, improve your scores, and then we take the highest score that you achieve. Sorry, and these are the interview questions we asked you. So you don't feel hopefully too nervous when Laura and I have our conversations with you. So a little bit about your background, your journey, because this is very important in terms of where you want to go, an understanding of where you've been, why an MBA, why the MBA Health, and what would make you stand out from the pool of applicants who are interested in coming, what you can contribute to the program, what specifically you offer, what are you expecting from us, some understanding that you've reflected on your strengths and your areas for development, and some sense that you do have some idea of where you might like to be in 2028, for example, in a very clearly uncertain world. So once we've been through the interview, we try very quickly to get back to people. So I usually contact people and talk to them on MS Teams. UCL can be very slow in processing information, so we do like to get in touch with you and tell you any good news quite quickly. As I said earlier, we have this onboarding of these self-paced primer programs to get you up to speed. So for example, we have fundamentals in accounting, finance and economics, global health and the UN's SDGs, study skills, time management, those kind of topics. So you choose what's useful to you. We have induction, which is very important. We have this off-campus residential school, one-to-one support, group coaching as well, and lots of events throughout the year, webinars, careers events, in-person events. So you can actually meet these people and get to know them, our executives in residence and our contacts. UCL is one of the largest, if not the largest university in the UK. So there are many resources beyond the Global Business School for Health, like the General Careers Service, Innovation and Enterprises services as well. Roche has very kindly offered a program, unfortunately, for people in the UK, but we're actually looking in future to develop more scholarships, hopefully from Merck. We're talking with them. We have a Future Impact Leaders Scholarship that may interest you. We also have a Women Healthcare Leaders Scholarship. And the final one doesn't necessarily link unless you are already in London and you're going to live in East London or from East London. We also have a 5,000 for people from that part of London. And of course, there are many other scholarships in the world. So I think the Chevening has now shut for India, but there are opportunities, Commonwealth scholarships and so on. So you can look at UCL Scholarship Finder to see eligibility and deadlines for those scholarships. UCL, clearly you want to network and you don't want to work all the time. So there are over 250 clubs and societies. There's lots of sporting activities, political societies, volunteering opportunities. With a visa, you can work 20 hours a week. So we can put you in touch if you want to work in an NHS hospital, volunteer. There's clearly with COVID and pandemic stresses, lots of help also for mental health and well-being. I know it can be very distressing working and living perhaps in another country, leaving home, moving to a different climate. So there's counselling services, and we're very aware as the MBA Health program team that we need to look after your health too and our health. So being in a park, a beautiful Olympic park, is a great advantage because we can run around the park in between classes. And there's a students' union as well that has plenty of advice. So this is what our park looks like, our buildings. A very generous Indian billionaire built this Mittal helter-skelter, iconic, don't know what to call it, feature on the right here. So hopefully we will go down that helter-skelter one day. So we've got 2 brand new buildings that are opening. And I was speaking to Helen Fisher yesterday, who's in charge of liaising with us about moving over to UCL East. And she says anyone who joins the MBA Health program is guaranteed a place in the student residences. which are absolutely magnificent, actually, state of the art. They built them with students, lots of social space, in lots of beautiful views as well. So the residences are built over the new building. So if you're worried about where you might live, you can actually live in one of those buildings, or you can live locally in UCL East in private accommodation, or you could live in other parts of London. So our classes, as I said, are 1 to 6. So you may actually even live outside London and commute in to join us in the afternoons. But certainly we'll help you settle into London. So it's got one of the biggest, and I think certainly the best shopping centre in Europe, in the UK, with lots of eating places. Because of the Olympics, this place was like nothing in the 20th century before the Olympics came to London, and it's a very vibrant area. So you've got the park in Stratford, East London, you've got City Airport, not far away, and lots of other institutions are moving to this area. So the Victoria and Albert Museum, the Sadler's Wells Dance Studios, BBC Music, you've got University of the Arts London, University of Loughborough, the College of Fashion, all these facilities on our doorstep, and we work with these people as well. You've also got the food. As I said, the shopping centre. It's very close to St Pancras International, where you can go to France in a couple of hours, Amsterdam, Brussels, and clearly lots of sporting. So one of the buildings is called Pool Street, and it's called Pool because of we've got the aquatic centre as well that was built for the Olympics. You can see I think that's the building on the left. UCL is spread all over London. It has 16 libraries. The main kind of hub of UCL is in Bloomsbury. So clearly we may have classes there from time to time. This is a view of the River Thames that kind of meanders around. When you take a boat ride, you suddenly think you're going back on yourself. But the fantastic city. I wasn't born in London. I was born in Wales. Thanks to my work, I travel a lot, but the more I travel, the more I love London. So there's great tourist attractions, there's fantastic free museums, sporting events, facilities. Compared with some cities, it has lots and lots of parks, so you can virtually walk around London going from one park to another. Pubs and clubs, and in the QS rankings, it was ranked top in the UK as a city. And it's easy to get out and go to other parts. You can go to Scotland, you can go to Birmingham, you can go to the south of England, the Kent coast to Cornwall. So it's a very livable city. You can walk around it as well. Okay, so I hope I've convinced you that GBSH, the MBA Health, is an option for you. We do have more events. We do have an executive MBA Health that we're launching in a year's time for students who are probably a bit later on in their careers, who can't physically perhaps move to London if they're not already in London. So that is that is part-time, but full online, apart from 1 week in London and 1 week in the States. So we'll be briefing you on that. We also have a scholarships and funding information session that you can join in May. We have another MBA Health Open Day if you want to hear us again, or there are also recordings of these open days that you can listen to. And you can also join us. We have a series of events that you might like to join us live or look at past events, and recordings of events are there. So further information is on our website. You can also get in touch with me directly. You can email me on julie.a.davies@ucl.ac.uk. So now it's over to you. Thank you very much for listening to me. So we're going to stop sharing and over to Surti, who's going to field the questions. So thank you very much.
Thank you so much, Julie. Thank you. So I'll just dictate out the questions and then you may just answer them. So First we have is, hello, what is the entry requirement for MBA Healthcare course?
Yes, so there is a slide if you'd like to look back at that.
Yeah.
So it's a degree
About to
that's
mention.
equivalent to a 2-1. It's work experience. It's the GMAT or the GRE, the IELTS, if that's necessary, the interview, and 2 references.
Okay, so now I think I'm not sure about this question, but you will tell me better. What is the percentage requirement in UG for this course?
Can you like to say that again? What is the percentage?
What is the percentage requirement for UG for this course?
Undergraduate.
Yeah, I believe this is an MBA. So
yeah, so this is a PG, not an UG. So it's for people who have already graduated to come on to the postgraduate MBA program. We only offer postgraduate programs.
Okay. What are the career prospects after this course, and is there any part-time work options while studying?
Yes, so if you have a tier 4 visa, you can work 20 hours a week. So clearly London, we have a huge shortage of workers in the hospitality industry. People are always looking restaurants, bars, pubs. Clearly in the health sector too, there's a huge shortage of workers, qualified and maybe clinically qualified. Clearly you'd have to do PLAB if you wanted to be, work as a doctor here. So you can work 20 hours a week to supplement your income if you wish, but also to enhance your career. So we could work with our executives, for example, David Probert at the hospital around the corner for us, and say, somebody would like to work in ED, or somebody would like some voluntary work,
right?
As well as some paid work. So within the legal requirements of your visa, you can do 20 hours a week, which obviously you need to balance at different times with your studies. And the first part of that question, where do you go afterwards? Yeah.
Next we have is, you just mentioned about the scholarships. Can you please elaborate?
Yeah. So just to answer the previous question about where they go afterwards, that you will find slides, management consulting, NGOs, clinical director. You may not be a clinical person, but we'd hope very much that you would stay within the healthcare sector, but there are huge opportunities for you to go into maybe legislation, academia. Okay, so thank you.
Okay.
Say that question again, Serti, the next one.
Yeah, sorry. So you talked about scholarships, and they want to know, can you please elaborate a bit more on these scholarships?
Yeah. So if you're applying for a GBSH scholarship, go to our website, and we require you typically to write about 500-word statement about yourself. So that's good practice in a sense to answer the interview questions I indicated earlier. What's your motivation? How are you going to make an impact? What can you contribute? So in a sense, usually when I prepare for an interview anyway, I kind of write some notes to myself. So your interview and your scholarship application will be very similar, but you just obviously have to look closely at the scholarship criteria. If it says ethnic minority, BAME, women, and women, then clearly if you're a white Anglo-Saxon man, that scholarship you're not going to get it. So just make sure you fulfill the criteria of the scholarship, meet the deadline, and so that's for GBSH. Clearly there are UCL ones. You could have 2 or 3 scholarships. There's no short, we don't say just because we've given you one scholarship, we won't give you another. You can apply for more than one. And I know India has a Chevening scholarship, which I think closed in March, for people who will go back to India. So you have to guarantee that. So be brave, go for anything that looks relevant with the deadline. And I think certainly we are aiming to be as generous as we possibly can.
Okay, thank you. How many years of experience required to join this program? Can someone who does not have any healthcare academic background but have certain experience in the same field can join this MBA program?
Yes. So you can have no background at all. I worked in the National Health Service for 3 years myself in change management and HR, having graduated in law and languages. So clearly we need people who are not part of the clinical workforce too. So ideally we do want people, we've said on the slide, with 2 to 3 years work experience, but it may be that you've been a medic and you've been on placements during your studies. So that counts. Or you may have volunteered while you were in school. So you don't have to have a clinical health background. That's fine, but you just need the ambition that you want to work in the healthcare sector. And you may have quite a patchwork of work experience as well. So I guess the bottom line is we don't want people without any work experience, who've never worked in an organization. We want some kind of understanding. And even if you don't have a medical clinical background, that's fine. We already have recruited people without that, but you want to be a leader or a manager in the sector.
That's great.
Or a consultant. Yeah.
That's great. Okay, I think you've just answered this question. What is the GMAT GRE requirement for the program? I think we've covered that.
Yes, it's around 600. Yeah.
So how much demand has the NHS for this type of MBA?
Huge, I think, in the NHS. There are a lot of CEOs who are historians or who aren't clinical leaders. And I think clinicians would like to see more CEOs and senior people running healthcare who are MDs, MBAs. They have both. So I think we've seen in the pandemic a real lack of leadership, and we've seen reports. I mean, there have been terrible reports about suicides, about, burnout, and they have attributed some of this to lack of leadership and management. They're not being listened to. Some people aren't getting their appraisals. They want maybe to go part-time for a while. They want to change their jobs a little bit, maybe work in the community if they're working in ED for a bit. And they're finding that their line managers are too busy. They don't have people management skills. So I think this, as I said before, the hybrid person who can combine a background, maybe in clinical work or general management, and then understands healthcare. This is very sought after.
Okay, thank you. Next we have is, please do share an insight on what should students include in their personal statement to make it stronger.
Okay, so we want to find out about you as a person, really. So when I mentioned those questions earlier about your strengths and weaknesses, so when you tell us about yourself, we'd like to know, what is your story? So I think storytelling is quite an important skill. So we have one student who's a dentist who does voluntary work in the Mumbai slums. She's very influenced by her mother, developing her, as a woman in healthcare. We had another medic from India, actually, who was from a rural background and felt very lucky to have become a doctor, but wanted to go back and help those rural communities. He's working in a pharmaceutical company on antimicrobial resistance. So a kind of feeling of, where you've come from, why you chose your particular subjects at school and at university, your university experience, what you're doing now, and then kind of a thread of how that might fit together and where you're going. So for instance, one person from the Gulf said, I'm working in a dentist. I'm in a huge hospital in dentistry. And actually, I want to be Minister of Health one day. Wow. So I'm talking to some people in government. When I go back, I still want to continue my dentistry, but I'd like to take a few hours in the afternoons to do a project with a minister. So maybe in 20 years, I'll become the Minister for Health. So just kind of an overview, where you've been, where you are, where you're heading.
Your willingness, totally.
And your weaknesses. I'm very impatient. I'm not good with people. I don't understand numbers. I'd like to know more about data analytics, digital transformation in healthcare. So a story that we will be continuing this conversation going forward from your personal statement.
Okay. Thank you. Next is, I think it's covered. This was again about the personal statement. We've covered that. They want to know what are the cases where one could get GRE or GMAT waiver.
Yes, so people email us, they say maybe I'm a physician and they've been through lots and lots of exams. So that kind of suggests that they have the kind of attitude and kind of general IQ and abilities that the GMAT is testing. So so you have to justify personally why you think you might not need to go through GMAT. So GMAT is a kind of test of verbal reasoning, numerical skills, kind of general IQ and intelligence. So if you have done lots of exams in the past, and you can send us up your transcripts. So if you've got good grades at university that indicate that you're a good student. I mean, some people do like to boast about their GMAT scores. I got 650, I got 800. So for some people, it's a kind of rite of passage. But if you have a really busy job and you can't spend 4 hours doing the GMAT test or preparing for it as well, we can consider that on a case-by-case basis.
Okay, thank you. So next is, could you please repeat the timings of the classes?
Yes, so we start on the 26th of September, and then the classes actually run in these 4-week blocks, 1 o'clock till 6 o'clock. So in the morning, you might be working with your team, you might be doing other things at UCL, doing some voluntary work, but the actual in-person classes will be 1 to 6 every day for that 4 weeks. Then you have a break, then you have another 4 weeks. So hopefully we'll recruit people who can stay awake in the afternoons.
True. Okay, thank you. Next is, please update the process or guidelines on the 2-week immersion field experience, that is the Global Health Challenge, and the Health Consultant Project, a consultancy project delivered with one of our partner organizations.
Yes, so we'll be talking about these throughout the year, but you deliver at the end of the year. So hopefully, if you're doing a project in Saudi or Nigeria or India, and someone in your team may be working on the finance bit, but you're weak at finance, when you go to your finance course, you can develop confidence in finance and build it up. So basically your 2 weeks is intensive. You'll visit hospitals, you link with our university partners, site visits. So you'll be really on the ground connecting with people in Riyadh or Lagos or wherever, in your group, working on a problem. So somebody in your group might be looking at operations, you're looking at strategy, someone's looking at HR, but you're bringing those perspectives together to solve the brief as a group. And then you come back and you continue to work on that brief when you've been in the field. For your own project, that will be you working in a company or NGO or going back to form your own business, if that's what you want to do. So that will be more of you working on your own assignment rather than a group assignment and developing your consulting skills. So in some ways they overlap because they're both consultancy projects, but one is in a dedicated country as a group, which hopefully will give you the confidence then to do your independent project for your company that will get you to the next career point.
Right. Okay, thank you. So the student wants to know about, if you could share your email ID.
Yes, it's on the last slide. So it's julie.a.davies@ucl.ac.uk.
So I'll just type it out. Julie.a.
Davis with an E.
Yeah.
UCL.ac.uk. Yeah.
All right.
Thank you.
Next is how many years of experience required to join this program? I think we've covered this again. Okay, this is covered. They want to know the English language requirements. Would there be options for waivers? Again, a similar question.
No waivers. No waivers.
Yeah.
There is a kind of overarching UCL policy. So unfortunately, we can't do anything. You may speak brilliantly English at the interview, but we can't change that.
True, true. Okay. Last question we have here is, I have background in electronics engineering. I am really interested to do MBA healthcare. Am I eligible?
Absolutely, yes. So if you want a career in health, digital, electronic expertise is very important as we move forward, telemedicine and so on. So if you have ambition to be in health, you meet the other requirements, IELTS, some work experience. We'll be very happy for you to apply and be considered.
All right. Thank you so much, Julie, for your time and support to help these students know their questions and get them answered. And you can also get in touch with Julie. I have mentioned her email address over the chat, and you can reach out to SIUK India office also. And I have also given out my contact details if you have any further questions. And I would also like to thank Sophie and Preeti who joined, and Adam as well for joining us. And that's all for today.
Thank you very much, Sruti.
Thank you, Julie. Bye-bye.
And for your questions too, they're excellent questions. Thank you for your time.
Bye. Thank you. Bye.